Pero what should we watch out for? Professor Ray, or known as the the doomsayer in the group.
Grabe ka naman.
I
Kinahon mo naman
gladly
si
take
Professor
that.
Ray.
I gladly accept that moniker, that position in our group. In fact, we had a discussion last night, and I've always reiterated in our group that we should be the voice of vigilance, sobriety. That our data, while we have scientific data to prove that the downward trend is real. Sustaining that trend requires all of us to be vigilant, requires all of us to focus on enforcing and practicing minimum public health standards, the wearing of face masks, if possible face shields in indoor spaces, and trying to avoid generally crowds and enclosed spaces. Especially for the unvaccinated, that would include our kids, would include some of our elderly who have remained unvaccinated. The reality is, trends can change. There is, while it's the probability is low, the possibility is always there that we could have a Christmas surge, like as experienced by many countries around the world. Last year we were able to dodge that bullet, largely because government and private sector, our communities were warned early that if we are complacent, if we do things irresponsibly, we don't stick to the plan, and we don't do our roles, which is to keep ourselves safe. These trends can easily reverse and become a surge. So this is the reality of it. We need to sustain it. And to sustain it until early part of next year will require all of us working together.
What are the biggest areas of concern for you? For example, yung proposal for 100% capacity in PUBs, for example, or yung sa easing of restrictions on children. And ano yung particular areas of concern?
For me, the particular area of concern would really be children, honestly. Unless we have some level of certainty as far as the number of children vaccinated are concerned, until we have more children vaccinated, I'm skeptical about exposing them, to more risk. So it's very risky, really, at the moment. Delta is here to, in a sense, COVID is it's the move now. In terms of mindset, it's going to be endemic. We're going to have to live with it, and therefore the goal now is to ramp up to max vaccination, even with our children.
Professors, could I ask you to be a bit more specific as far as what could disrupt the trend, the downward trend? Because I have heard some arguments that it would probably be, if at all, a new variant. Pero what about, quite simply, yung downgrading alert levels? More people out in the streets, more people in public conveyances, more people in public areas, looser restrictions. Could that as well trigger a change in the downward trend?
Guido, you start.
Yeah, okay, because I think the Professor Ranjit and I have a slightly different viewpoint dito. In fact, we sometimes talk about this. I have a more optimistic outlook than Professor Ranjit. Sabi niya nga, the doomsday device. So, yung sa akin naman, what I think is yun nga, yung the variant is the main concern. Yes, possible na makakita tayo ng upticks. And there are still regions na hindi pa masyadong tinamaan ng Delta variant. They will still be vulnerable to surges because of yun nga, yung experience nila sa Delta variant, and because hindi pa masyadong mataas yung vaccine uptake nila in some provinces. Kasi hindi pa naman kumalat all over the Philippines yung Delta variant. It's hit most of the major metropolitan areas, but not every place, siguro. There are some places na, yun nga, na hindi pa tinamaan. But so kung hindi tayo careful, we could still spread the variant there. Yung sa Metro Manila naman, we're close to 100% coverage of the adult population. This will help a lot. We might still see upticks in cases if we're not careful, because may mga breakthrough infections, yung mga kids are unvaccinated, and that's why yung concern ni Professor Ranjit is mainly yung mga unvaccinated. And there's also another factor, yung waning efficacy. This could be game changer in the sense na, if we're not careful, baka biglang nagkaroon ng waning. Kasi hindi to well established yung data dito. It's not clear kung talagang 6 to 8 months ba, which brands are nagkakaroon ng waning. Kasi pwedeng baka kampante tayo, hindi pa naman magwa-wane to, tapos biglang nagwa-wane na pala. So, yes, because of the uncertainty, this could be a contributor. Kasi nakita na natin yun in other countries na because of waning, nagkaroon ng spikes sa Israel, for example.
Also, it's also a challenge in Metro Manila because we have the highest vaccination rate. Dito rin yung pinakamalakas yung pag-wane, di ba? Pinakamaraming tao yung nagwe-wane yung vaccination. And there's that possibility na baka nga maraming breakthrough and we will have another surge. Lalo na tatama siya, as you mentioned, by election day, by around election time. So,
Possible.
I understand you are already discussing it with at least the private sector or the government. And is there any serious discussion on boosters na nga for those who might have waning vaccination?
Yeah, I think the government is very much aware of the challenge. And I think the priority is now with the healthcare workers. They're the people we need to prioritize, and the elderly. And I think we're going to probably follow the WHO guidelines here, where not all of the elderly, but those who are very old and sickly can be prioritized. The key is to get everybody vaccinated. I think that's the first step.
Yeah.
And we have enough supply by the end of the year for everyone. The next step is to get the children vaccinated so that we can start opening up for school, no?
Yeah.
And those are that will go in stages. My sense is government is aware of this. There's a robust discussion. But right now, the priority is to open up in a safe and calibrated way our economy, and that is now the focus of the IATF in our view, and they're doing that now in consultation with the private sector, with health experts, and in OCTA we're here to share our monitoring reports, and when we see upticks, we report as usual, not just to IATF but also to the media, so that people may know.
Professor Rai, balikan ko lang po yung binanggit nyo kanina, and tell me if I got this right. Parang you had some concerns and you talked about this na baka matsyempohan yung surge doon sa bandang eleksyon, if not election season, at least sa first quarter ng 2022. What's the basis for this concern? Does it have to do with the cycle of the surges as you see it, or does it have to do with some other elements?
No, well, this is just a theoretical discussion we had with Father Austriaco and the group, no? That if indeed the theory is it lasts for 8 months to a year, we'll probably have the first batches, largely healthcare workers, who were the first to be vaccinated in March, probably experiencing waning efficacy first among others, no?
Yeah.
And that will be towards March, April. And the possibility that because they have waning efficacy of vaccines, they might be more vulnerable to whatever new variants that will likely evolve and spread. And this might be a possible source, no, of upticks and possibly surges in many parts of the country and even Metro Manila. So, which is why the argument about boosters is important. And who do we boost first? No, in our view, in OCTA, we should provide boosters for our healthcare workers. We should provide boosters for that part of the population that is very vulnerable, the elderly.